OCD treatment is something that's tough and it's challenging. When we go to treatment and when we're actively engaging in treatment, it's scary. It's anxiety provoking. It certainly doesn't feel good. But the reward makes it all worth it. The reality is that if we don't get proper treatment or we decide not to engage in treatment for whatever reason, our OCD will continue to get worse and will continue to define us. But the moment we decide we are going to actively participate in treatment, even though it's tough, even though it's challenging, we're going to participate in it because we want to be able to live a life despite this diagnosis, that's when we really see these wonderful rewards. Treatment for OCD is not a one-stop shop. You don't go to treatment once, get better, and never worry about it again. For those of us that live with OCD, especially those of you that live with OCD like myself on a higher level, I will always be engaging in treatment. Every day of my life, I have to push against my OCD. I have to do active exposures. I still go to therapy once a week. That's not a negative. That doesn't mean I haven't learned how to live with my illness. That simply means I have learned how to live with my illness, and I've learned what management means for me. Management's different for everybody. For some people, you may not go to treatment the rest of your life. For some people, we may choose to. But treatment is about taking ownership. It's about saying, I want to be able to live a life that's worth living, even with an OCD diagnosis. And the way to do that is through proper treatment and proper help. The thing that's kind of most important for us to remember is that treatment's on our own. Often we go to treatment and sometimes we'll live with a certain type of OCD like contamination, and we'll learn how to apply exposure with response prevention and we'll be doing really well, and then we're at home and 2 months later there's a new trigger and we're dealing with harm to self OCD and we've never had that before. And often people say, well, I've relapsed and treatment's not the same and I don't know how to deal with this type of OCD. That's actually not true at all. Treatment's the same. Exposure with response prevention is used across the board for any type of OCD you're living with. It's just that you might apply those tools a little bit differently, right? The rituals of hand washing might now have changed to rituals of checking that I'm making sure harm didn't come to someone I love. But the exposure with response prevention is the same. We remove the rituals and we slowly expose ourselves to the fear. And so it's really important that we understand part of a healthy relapse prevention model is learning how to apply our treatment tools to any type of OCD we live with.